We all have a natural tendency to view the world from within our own silos, focusing first on our own challenges before thinking of others. And while this may be more efficient in solving immediate tasks in the short term, I believe the solutions to the greatest challenges are found when we'll step outside of our silos, listen to others, and make connections. I want to share a few stories, various stages of 3M's history that illustrate this point and show how that ties at the end to our collective future in healthcare. Dick Drew was a 3M engineer in the 1920s, tasked by his boss to develop the newest sandpaper for automobile manufacturers. Yet as he walked into the factories and observed the workers and their jobs, he realized they actually had a bigger problem to deal with than better performing sandpaper. They were struggling to get clean lines for the two-tone paint jobs that were all the rage in the 1920s. The paint would often bleed through the newspaper and drip onto the car. From those early conversations, Dick got the idea to actually reverse the manufacturing process that they had used for sandpaper and create a brand new adhesive product. When he told his boss about it, his boss told him to quit wasting time on this new idea and to keep focusing on sandpaper. But Dick persisted late at night and in his spare time, and out of that, masking tape was invented. More importantly than just inventing masking tape, he actually created a technology platform that paved the way for thousands of tape products over the years that we all know and love. 30 years later, after World War II, a group of physicians approached 3M scientists to help them solve a problem they had been having during World War II that intensified. The challenge they had was they were unable to keep the surgical site clean, and there were many that were dying due to infections. 3M knew nothing about healthcare at the time. In fact, our engineers were focused on making better sandpaper and new tape. But they took the time to listen and stepped out of their silos, and this unlikely combination of doctors and 3M adhesive scientists invented a new surgical drape that lightly adhered to the skin, was infused with iodine to reduce infections, and is still in use today. More important than that one product, that actually paved the way to founding 3M Healthcare. 3M Healthcare is now an $8 billion business with thousands of products and sales in countries all over the world. So let's go another 30 years later, in the late 70s, early 80s, 3M Healthcare found ourselves in the microfilm business. We sold the microfiche film and machine readers to hospitals for storage of their medical records. That was back when medical records looked like this. During that time, there was a man by the name of John Morgan who was working on a new idea for his PhD thesis at the University of Utah. Contrary to how most computer companies were thinking at the time, Dr. Morgan believed that it was the obligation of the computer to learn the metaphors of medicine and not the other way around, which was to try to make the physicians think like a computer. He developed a solution for coding and classifying medical records by using clinical decision trees. Dr. Morgan felt so strongly about his idea that he outfitted his RV with a mainframe computer, because that's what it took in those days to run this software program. And he toured the country, going from hospital to hospital to have one-on-one demonstrations and conversations with potential users of his new software. This newly created software began to grow and got the attention of the business leaders of Microfilm in St. Paul, Minnesota at 3M. And rather than stay in their silo of making microfilm readers, they chose to take a risk on John and acquire his startup. From those unlikely connections, a whole set of software solutions were created that are now the basis of software used by 75% of the hospitals in the United States. It became the platform for 3M Healthcare Health Information Systems Division. It's a $1.2 billion revenue business. It's headquartered right here in Utah with 2,500 employees, and makes up one of the most fastest growing divisions inside of all of 3M. So I wish I could tell you that every story at 3M worked out this way. Unfortunately, we've missed out on many big opportunities due to our inability to make critical connections. For example, I personally invested significant time trying to connect the orthodontic division, 3M's dental division, and a small but fast-growing company that using digital technologies to make clear plastic trays to align teeth. We could see the future growth, and on paper, the combination of the three seemed like a perfect match. Unfortunately, the project wasn't as profitable in the short term compared to a lot of the other projects 3M was working on. And we, 3M, were not willing to compromise certain positions we held dear. Well, that company was Invisalign, if anyone's heard of that. And it's now worth, if you've checked the stock price, $50 billion, significantly more than our orthodontic division and dental divisions combined. And in fact, it's worth half the value of the entire 3M company. There are many other programs we've had to shut down after investing a significant amount of time and resources and energy. And as I look back, the issue with many of these failures that did not work was not a lack of creativity or innovation. It was usually because those programs started by asking the question, what's in it for 3M? Or how do we most quickly create a $100 million business? Rather than what we learned from Dick Drew, our sandpaper engineer, who started with, what are our customers' biggest problems? And what do we need to do to solve them? So let's talk about the future. And because this is a technical conference, I'm going to show you a highly technical slide. This is a picture a young girl drew after her visit to the doctor. And as you'll notice, the doctor's sitting over in the corner with his back turned towards the patient, staring at a computer screen. If you can see closely, the only thing that's not accurate about this picture is the doctor's got a big smile on his face while he's doing it. Physician burnout is a major challenge that we're all facing today, and not just because of the complications due to COVID. For a number of years now, almost 2/3 of a physician's time is actually spent in administrative tasks. And the complexity of the documentation requirements is only getting worse. One of my favorite books is God's Hotel by Victoria Sweet, if you have not read it. She talks about her experience working at one of the last almshouses in America. She shared some miraculous stories of patients' increasing ability to heal when they had a doctor who cared enough to look them in the eye and show love and empathy. Our doctors cannot make these connections with their patients and do their job effectively if they're overly burdened by documentation requirements. So this is a problem, creating time to care for physicians, that is one of our passions at 3M and what we're spending most of our time doing. And in fact, it's an area where technology, including big data, cloud computing, and artificial intelligence, can really make a difference for good. To make all of this happen, there's a number of things we're doing working behind the scenes. We love to live in the messy details that no one thinks about or cares about. But part of that is processing massive amounts of clinical data. We have been processing over 250 million clinical records a month through our natural language processing engines in order to classify and code records. On top of that, we're keeping track of all of the regulations, reimbursement rules, quality measures for each different country, different state regulations. So all of that can be taken care of behind the scenes, so again, that physicians don't have to be thinking about that. We're working on perfecting what we call the art and science of the nudge, and that is getting the right information to the right person, namely the physician, not more than what they need, at the right place and the right time. And in the future, we're adding an Alexa-like ambient listening device to the exam room that understands clinical terminology, so that when the doctor and patient are having a conversation, it listens and can automatically generate the clinical documentation for them, and they can just review. In the process of going through this, solving this problem, it's opening up many new possibilities. For example, insurance companies, pharma and biotech, and other entities are now engaging in conversations with us about how they might get access to this massive clinical store of records that we have. Also, given that we're at the point of care with the physician, offering them alerts and nudges at the right place and the right time, there have been many ideas that we might be able to use to work on this channel. I believe that, in addition to this problem that we're working on, many other problems, we need to continue to be willing to look outside our walls for good ideas that support our strategy. I learned that the hard way from one of those early deals. But for that reason, we've actually created a venture capital fund inside of 3M to allow us to invest in these great ideas that we see and help advise and be a part. On the other hand, we also are looking for those leaders that we can learn from and we can invest in and help them accelerate their growth. I want to highlight just 2 examples right here in the state of Utah. One is Health Catalyst and Dan Burton. What most impressed me about Dan was his willing to prioritize the needs of his customers and his employees above short-term profits. As one of their investors, I can tell you that Dan faced a lot of intense pressure to expand his short-term margins. But I can also tell you that he and his team have held steadfast to the values that they established. And in my view, that has made their IPO and their continued company expansion so successful. Another one I want to highlight is Collective Medical Technologies and Chris Klomp that we invested in. They've been recently acquired by Point Click Care. What most impressed me about Chris is his vision, his ability to get competing constituencies, payers, providers, social workers, states, to get out of their silos and collaborate around focusing on the patient. In fact, I can remember sitting with Chris in a meeting in Iowa with the largest insurance company in Iowa, and they had all 3 of the largest health systems and the executives there all in one room. And I sat there in awe watching Chris as he was able to get these leaders to nod their heads and agree on something that they'd been fighting about for years. It's no surprise that there were many people lining up to buy Chris's company. And in my view, we need many more leaders like Dan and Chris. In summary, we spend nearly 20% of our GDP, or about $3.5 trillion annually on healthcare. Per capita, that's more than double the other top 10 developed nations. Yet, compared to these other 10 nations, we rank dead last in all major health outcomes. How can this be? I believe part of it is due to many of us in the healthcare ecosystem optimizing our own situations and optimizing that within our own silos. In my view, the solutions to the problems in healthcare lie at the intersections of these conversations among all of us as healthcare stakeholders. Working across boundaries is hard. It's usually more complicated, it's more costly in the short term, and often upsets the status quo. But if more of us would be willing to give up something of immediate value in the short term and listen to the real needs of the customer, which in our case is the patient, like our sandpaper engineer Dick Drew, we have the potential to do something very special in healthcare and meaningfully lower the cost and improve the quality for our future generations. Thank you.